Becky Gilly feels great about her looks. Though she's always been pretty, she felt her brow line was too low and that it made her look older.
It was like I had no eyelids whenever I put my makeup on. You couldn't even see the, this part of my eye at all. And when I'd smile, my eyes would just go away.
So with her husband's high school reunion coming up, Becky boldly decided to get the surgery she had wanted for years. She came here to Atlanta Plastic Surgery to see Dr. Fernando Burstein, who is considered one of the world's best plastic and reconstructive surgeons.
My practice is limited to the face and neck. So it's something that myself and my crew and my assistants, that's all we do. It's a small niche, but you get to build up quite a bit of expertise after 20-some years.
Becky was nervous about the surgery, but confident in Dr. Burstein's expertise and experience. He's board certified in both head and neck surgery as well as plastic and reconstructive surgery.
I was comfortable with him, and he put you at ease and answered all my questions. So I was really comfortable with Dr. Burstein.
Dr. Burstein says the eyes are one of the first areas for facial aging, and the brows are key to making patients look younger.
And many times we'll do the upper and lower eyelids along with the brow. The important thing to keep in mind is that the brow needs to be in its proper position before the eyelids are done. Otherwise, you'll actually be making the eyes look smaller.
Brow lifts can be done in different ways. Dr. Burstein says traditionally a brow lift involved an incision that goes from ear to ear. But a new procedure is less invasive because it has 3 small incisions and works well for younger patients like Becky.
And what's evolved over the last few years is more and more minimally invasive surgery, where the surgery can be done through a little telescope through 3 small incisions without shaving hair and without the risk of losing hair follicles or having unsightly scars.
After meeting with Becky and listening to her concerns, Dr. Burstein assured her that the recovery time wouldn't be difficult. Still, she was amazed at how easy it was.
I was really scared to begin with, but then it was like 3 days that I was a little uncomfortable, and it wasn't even like bad, it was just uncomfortable.
Becky's surgery went smoothly and she had no complications. Dr. Burstein's advice to anyone seeking a brow lift is to make sure your physician is board certified in plastic surgery.
Somebody that is board certified in plastic and reconstructive surgery, somebody that has hospital privileges, that's very important.
He also recommends having the surgery in a hospital setting with general anesthesia.
So if there's any problems whatsoever on the medical side of things, those can be taken care of.
Dr. Burstein recommends doing plastic surgery like this in steps rather than all at once.
I approach facial aging is through staged procedures if possible. If someone comes in their 30s or 40s and it's the eye area that's of concern, then we try to concentrate and rejuvenate that area with a minimally invasive technique.
Dr. Burstein says the ease of the procedure and the perceived belief that youth sells in the workplace have resulted in more couples coming to him.
It's really something that people do for themselves. So maybe instead of buying the sports car, they may do this. Often I do couples where the wife and the husband want to have something done together, so they're sort of aging at the same time or at the same rate. Most men and women that come in for a brow lift, the main thing they're worried about is looking like a deer in the headlights, and that keeps coming up. And so I think the minimally invasive surgery is ideal for that type of a candidate who wants to look refreshed, but not a whole lot different.
Older patients may need the traditional type of brow lift.
So there's not one brow lift that is good for all patients.
For Becky, the surgery has made her feel better about her looks, and she loves getting compliments like the one she recently heard from her 11-year-old son.
One day he was sitting in the back seat of the car, and he was looking in the mirror and my reflection. He goes, "Mommy, you're so pretty." And that was not long after I'd had the surgery, so that made me feel great.
For Dr. Burstein, helping people like Becky feel better and look younger is all in a day's work.
And that's really what you're looking for, is for a satisfied patient that looks better and feels better about themselves.